Welcome to Kids Matter. I'm Dr. Elise M. As a pediatrician, mom, and grandma, I understand how challenging it can be to help our kids grow into their best selves. We are so much more powerful together. Here, I will be sharing the knowledge and wisdom of a wide range of people who understand and care deeply about children. I'm hoping for your input as well, because kids really do matter. They are our future. Hey, welcome back to the Kids Matter podcast. I'm really honored and really excited to have today Dr. Elise Falluco. She is a child and adolescent psychiatrist whose career has been focused on empowering pediatric clinicians to provide high-quality mental health care. Dr. Falluco is the creator and host of the podcast Child Mental Health for Pediatric Clinicians, and I will post the link to that in the show notes. She is nationally recognized for excellence in training clinicians to identify and treat children and teens with mental health problems. Her educational programs and research have been published by many esteemed medical journals, including the New England Journal of Medicine, the Journal of Adolescent Health, and Pediatrics. So I'm really excited to have you here today, Dr. Falluco. I just came back to work with a focus on mental, developmental, and behavioral health. So I'm really excited to have you here, not just for parents, but also for clinicians, or what we call them professional parents, right? Some of whom are parents, some of whom are not, but for all of them, because I think we have an angle for everybody here today. I think it's really important because we have a mental health crisis.
Yes, Dr. Minkin, thank you so much for inviting me and for having me on the pod. This is such an honor.
I want to talk about really specifically anxiety disorders. There's lots of things we could talk about, but before we even get into anxiety disorders, I want you to tell us the basic definitions of not just anxiety disorders, but anxiety, because it's not the same thing.
Right. And I think colloquially, the term anxiety gets thrown around, whether you're talking about disorder level anxiety or normal anxiety. And so I just want to make a distinction. Anxiety is a normal human emotion that we all feel at different times. And in fact, it can be very healthy and adaptive. And it's our bodies and our brain's way of telling us that something is going on there that we need to pay attention to. If anxiety occurs in really short bursts and we're paying attention to it and we respond, then that feeling of anxiety goes away and we're fine and can return to normal function. The problem becomes when it gets to be what we would call like a disorder level or something that's clinically concerning, in which case what we see is that kids and teens will feel anxiety that's out of proportion to the stressor that they're experiencing. And it's something that's persistent that goes on to affect their whole bodies, affect how they're, affect their day-to-day life, and affect their ability to just enjoy and function well as a kid or as a teenager.
That's a really good answer, succinct. I like it. I always think about it as frequency, intensity, duration, and how much is impacting function, right? Because it's a spectrum. It's not like there's anxiety on one side and anxiety disorder on the other side and nothing in between, right? And I think it's really important for pediatricians to be screening for anxiety. And I think many of us do. I think most of us do on some level. So what would you say the role of the pediatrician or a pediatric professional? We have nurse practitioners and PAs and MDs and DOs, all of those. What would you say the role is in detecting and possibly treating pediatric anxiety disorders?
The very challenging thing about anxiety is that it's what we call an internalizing disorder, meaning that it's something that kids and teens experience on the inside of them, and it's really hard for even them to recognize that something's going on and that they're not feeling well. And so it makes it critically important to have a medical professional or even have your parents or somebody else screen and try to figure out, is there anxiety present? Because just by looking at a kid, you wouldn't know, are they experiencing anxiety? And if you catch them on a good day or if things are going well and there's not a particular trigger, they can look like everything's great. And so it's not just my recommendation to screen, but the U.S. Preventative Services Task Force for years has been saying that in kids, I believe it's 11
I think they said
older.
8, but it's
older.
harder to screen for 8 because I find that the younger they are, the harder it is to really assess that in a screen.
Thank you. It is okay. They say that in kids 8 and older, you should be screening for anxiety. And, there are these simple checklists that you can fill out. And, you and I have talked about this before. There's sort of lengthy checklists called the SCARED, the Screen for Anxiety Related Emotional Disorders. It's 41 items, really lovely, but very long. They also have a shorter version called the SCARED 5, which we have on our website, the psychedforpeds.com. And that's one that I really recommend that people consider looking. It's not going to give you a full picture of anxiety, but it's sort of like a quick and dirty way to have a child fill out a couple questions, a parent fill out a couple questions, and get a feel for, is there
When you
something
say quick and
maybe
dirty,
going
I
on
used
here
to
that we
do the
didn't know?
scared, and the scared has many different subcategories of anxiety, and you're supposed to divide it out. And it would take me so long to do it to get the subcategories. And it does give you some information, but it's the opposite of quick and dirty. Pediatricians are busy. Just
Yeah.
if you can do that screen,
Yes.
don't worry about it. Just look at the overall number as a screen. It is limited in the sense that a child may have a very specific subtype of anxiety, and the total may not reach the threshold, and yet they may really have a significant like phobia or separation anxiety or whatever. That's where the history comes in. I don't know that the scared is a good routine screener, though. I think of the PSC, I think it's the pediatric symptom checklist, and there's different numbers, 17, 25, I don't know. How do you look at that as an anxiety screen for the general population of kids?
So that's, like you said, it's a general screener. It's looking at how are you, trying to assess for a lot of things at once quickly, like attention problems, behavioral problems, anxiety, issues with your mood. And so it can give you a general feel for, is there something here, but it's not specific for anxiety. The other thing that I like to talk to families about is trying to think about, is there a question or two that you could ask a child to assess what they might have anxiety? And unfortunately, anxiety is one of these things where you can't just say, do you have anxiety? Who knows what anxiety even is? And even adults, I think, have a lot of misconception about what anxiety is. I think they think that having anxiety means having discrete episodes of perhaps panic attacks where you become overwhelmed and experience a lot of physical symptoms, heart racing, shortness of breath, things like that. And while that occurs, that in our population, that would be more something that you'd see in older teenagers and adults. If we're really talking about kids and younger teenagers, their common manifestation anxiety is, what we would call generalized anxiety disorder, something where they're worriers. And again, they may look like everything's fine, but in their mind, they're constantly fearing that there's potentially something catastrophic that could happen at home or at school.
But back
or
to
to their
screening at
parents
8 versus, say, 11 or 12. We do in my practice screen all kids 12 and up with the GAD-7. The GAD-7 is free. It is 7 questions, and the kid themselves has to answer. Because one of the problems with the pediatric symptom checklist is it's done by the parent, and it's an internalized symptom. So I just want to make that really clear. We're talking to clinicians right now. In terms of screening, the GAD-7 is approved for tested on what age and up? But I don't think it's 8. And I find that the kids between 8 and 11 are often unable to read and comprehend and answer the questions well enough on the screens. Even the scared, by the way, even though the scared is approved for 8 and up. So I think it's 11 or 12 for the GAD-7, and I think that's reasonable. I think the task force is very lovely, but for all practicality, you can screen 11 or 12 and up with the GAD-7. And I really think you should, because we are having an absolute explosion of both anxiety, depression, and both. And maybe you want to talk for a few minutes of what other things are often associated with anxiety.
Yeah, when I hear anxiety, you mentioned anxiety and depression. And one of the clinicians who I work with here in Florida likes to talk about the idea of a candy cane, that if you think about the red and white stripes on a candy cane and how they run together, that's a little bit like anxiety and depression tend to run together. And in fact, there's a lot of overlap in the symptoms of anxiety and the symptom of depression. So sometimes it's hard to tease out, what are you dealing with? The other common comorbidity or something that commonly co-occurs with anxiety is ADHD. There's a huge overlap in ADHD and anxiety. And so typically what we'll see is kids will get diagnosed with ADHD maybe sometimes as young as 4 and 5, but definitely during elementary school or during the transition to middle school, high school. And then it's around the preteen, tween times that will also pick up on, oh, wait, I think we've
It is
also got some
bidirectional
anxiety.
and also confusing in terms of what actually is going on, right? Because, for example, you could have ADHD primarily inattentive, right? Because it's no longer ADD, it's either ADHD inattentive, hyperactive, or combined. So, say you have ADHD inattentive, which, by the way, is more common in our females and is internalized and invisible. And then, especially as they get older, they tend to be anxious because they can't pay attention. It's really what's coming first is the ADHD, which is often missed and untreated. But when you have a kid who people are saying is not paying attention and you don't know what's going inside them, it could really be they're not paying attention because they're anxious as the primary problem.
Exactly. And so the hard part that pediatric clinicians have to figure out is the issue that ADHD is primary and the anxiety is only related to issues to underlying ADHD. So in other words, I know kids with ADHD may have had problems at school or with tests or academic functioning, and so they're going to be nervous in those situations appropriately. Their anxiety about it is not out of proportion to the stressor. It's a big stressor. It's hard for them, and so they would have appropriate levels of anxiety related to that. But you would not expect them to have anxiety if this were just typical anxiety, or sorry, if this were not an anxiety disorder and it was just ADHD with ADHD related anxiety, then you would expect them to be fine in other situations and not have anxiety.
Boom.
Except perhaps around social situations. Let's say again, I guess I'd conceptualize it as like ADHD can affect multiple domains of your life. And so academic would be one, and the second would be social situations. So let's say you're an ADHD type kid that tends to blurt out answers or interrupt people while they're talking. As you get older in certain social groups, there are going to be friends who are frustrated by that and who notice, wow, she's different or he's different and I don't like that. And they don't know that it's related to the ADHD. They just are going to be, these other kids are going to be sending nonverbal feedback like, hey, or even verbal feedback like, hey, why do you always butt in? Or, hey, why did you say that? That's going to make the child with ADHD feel like there's something wrong or they're not as successful socially as they would like to. And so then, of course, appropriately, when they're in future social situations, they're going to remember, hey, I've had problems in this before. This doesn't make me feel comfortable. Maybe I want to avoid this. And so to your point, it takes a really astute clinician to try to tease out, is this appropriate anxiety in response to ADHD level problems with functioning and social?
Not only do we have an explosion in the amount of kids with these issues, but we don't have enough professionals at the same time, mental health professionals, to deal with it.
Yes.
Okay. The bottom line is that we in the trenches, we pediatric clinicians in the trenches are being asked to take on a lot of the burden, both in detecting and sometimes even treating these issues with all the other pressures we have, with our time pressure, with poor reimbursement, whatever. We could go on about that forever. And pediatricians and pediatric professionals, I'm hugging you right now, giving you that hug, because I say this all the time, it's so hard to be a pediatrician nowadays for many reasons. And this is a big piece of it. Okay. I just want to say though, screening does not take much time, especially if you don't do the scared, unless you have extra time. You do the G87 in the older kids. And there are ways you can do this. There are ways you can make time, but I think that's going to be outside the scope of this. But in terms of screening, please, if you have a kid who you're thinking has ADHD, please consider anxiety as well. And the other way around at the same time, right? So think about both. You don't have to always look for ADHD, but if you're picking up ADHD for the first time, I believe you should always screen for anxiety.
Yes. And then the other little pro tip or kind of clinical pearl that I wanted to share is that what which is both ADHD and anxiety run in families. And so you have a parent, or as a parent, if you know, hey, I've got a lot of anxiety in my family tree, that means that your kids are going to be higher risk for anxiety. And so as a benefit to your kids, you can kind of look out for patterns that you can recognize and say, oh, wait, looks like we're getting really riled up before certain events, and we're asking a lot of questions, seeking reassurance, want to know what to expect. And this feels like a lot. This doesn't feel like developmentally typical. Maybe I should talk to the pediatrician about what's going on to see if maybe I've given
We're a
child a little bit of
neurospicy
my
family. That's what we
anxiety.
call them nowadays. And I think these are the best parents because if they know it in themselves, they can pick it up in their kids and they become the best mama bears and papa bears sometimes, usually mamas. So that's a really good point. So let's go right into what we're going to get back in the parents' seat right now. What should you do if you suspect your child has anxiety? What would be the next step you should take?
So I would say if you suspect your child's anxiety, my encouragement would be to go see your pediatrician as a first step. And the pediatrician can be there and do the hard work of using the scared 5 or the GAD-7 plus a good clinical assessment and asking the right questions to figure out, is this appropriate level anxiety, or is this something that could be a disorder, something that's negatively impacting the child's life and their ability to have fun, engage with friends, et cetera. And if the pediatrician is concerned that it's a disorder level, at that point, I would strongly recommend getting therapy, particularly CBT or cognitive behavioral therapy, to try to support the child. And then consider whether this is a particular clinical case where the child might benefit from medication. I know there's a lot of stigma and a lot of talk about psychiatric medication, especially currently. And as a parent myself, I know that it's a hard pill to swallow to consider putting your child on a medication. And it certainly brings up a lot more issues than when you're talking about a medication for, say, an ear infection or something else. And so that, anyway, just acknowledging that, I also want to say medication can be incredibly helpful, particularly for anxiety. And after having treated so many kids for anxiety, what they have taught me is that, when you find an effective treatment or an effective patient, it really can be life-changing. And I've even had some of my patients come back to me and say, man, I wish we had done this a couple of years ago, or I wish our family had even known to come and talk to you a couple of years ago, because my experience in high school now or in middle school now is so different than what it had been. And I feel so much more like myself.
It is really
and so
great.
much more
It's so hard because there is a strong anti-medication bias going through right now. And it's problematic because your child needs what they need. But back to the clinician and back to the parent, if you do suspect this, I'm going to say you may want to ask for a separate appointment to address that, because it often comes up at the well visit. And we really only have so much time at that well visit. And in order to properly address a mental health problem, you need time. So I really suggest, as a parent, advocating for a separate appointment with enough time, and as the clinician, advocating for coming back and seeing me. Maybe it'll be a telehealth, maybe it'll be in person, but to make that time, that adequate amount of time, as a separate visit. And it might be multiple visits. I'm just saying.
Yeah.
So that's the starting point. Going to your pediatrician, fine. Getting referrals. I want to give a great resource out there for both parents and clinicians, and that is the Project Teach. I should really link it in the notes. Project Teach has programs, ongoing educational programs, more intensive, on demand, for clinicians who want to learn more about it, because most pediatricians are not adequately trained for the mental health. I'm hoping down the road it will change, because this is the thing that we still have to do. But so that is a great resource for clinicians, but it's also a great resource for parents. When you talk about screens, you yourself can go on the Project Teach website. I tell parents to go there sometimes, and they have a separate set of rating scales. And you, even as a parent, can print out a rating scale of what you think your child might have and complete them before you go to the doctor. Because we're always trying to get those rating scales in before. So that can be helpful, and for the clinician to order it. So what kinds of things can we do besides medication and besides therapy? Because there are at least one other thing I'm thinking of, and that's things from the school. Sorry.
Before we get to the school things, what I would say is the other,
Okay.
when thinking holistically about treating the whole child, yes, therapy plays a big role. And I want to put a quick plug in for therapy too. One of my colleagues, who's a pediatric oncologist, always talks about, when you recommend therapy to somebody, here's what you should say. You should say, look, by bringing your child to therapy, you're going to be giving them a set of coping skills and tools in their toolbox that they can use now and for the rest of their life. It's an investment, not only in now, but in future. And so that's going to be, anxiety is not going to go away and stressors are not going to go away. And so the savvy family that is able to get their kid connected to therapy is going to be doing a whole lot of good for them. So we talked about therapy, we talked about medication. Obviously, all of the things that pediatricians always tell you about good health, try to get good sleep and try to exercise. Those are going to be really helpful. Check on your nutrition. And then the role of the school, critical. What I would say, certainly each family has the opportunity to make a decision about how much information they want to share with the school about their child. But I think letting the school know that you have identified that your child right now is struggling with anxiety, is starting to get treatment, can be very helpful. And a lot of schools have different levels of supports and, everything from a 5-0 plan to an IEP, formally help your child navigate the specific situations.
Great. And just to clarify, a 504 plan is for accommodations, modifications for a child who doesn't meet the criteria of a student with a disability. So it could be a child with ADHD who's academically fine but needs to be refocused, redirected, or even a child, people don't know this, a child with anxiety may need extra time on tests or may need school-based counseling. And again, not everybody wants school-based counseling. Some people want to keep their child's mental health challenges private. But to the degree that the mental health challenge affects the child in school, I do recommend utilizing school resources, right? Especially if a child has, say, ADHD and anxiety and they need counseling in school to deal with that. Or sometimes group counseling. Wait, I want to say one more thing before I forget. And that's that you talked about a toolbox. And I had a patient once who was about 10 years old at the time who was getting excellent therapy and at one point needed more. Put the child on a medication for anxiety. And the child said to me the smartest thing. He said to me, now I have the key to open my toolbox that I got from therapy.
Oh,
so parents, listen to what this bright child said and keep that in mind, right? We don't want to throw medication, and we don't want, if you're a parent and you're coming to the pediatrician and you feel like you just got a drug, like I always say, it's not like strep is to antibiotics as anxiety is to Prozac. It doesn't work like that. Right?
Yeah. It should
be more
complicated.
complicated. And unfortunately, there is time pressure that pediatric clinicians are facing. And that's true also for mental health clinicians who are taking insurance, under the gun to do relatively quick visits, right? I don't have an easy answer for this other than as a parent, right? Yeah. You're still the mama bear or papa bear. And you're there to advocate for your child to get good health care, mental health care too.
Yeah. And I do think part of that is like what parents can do is, after listening to this podcast, your other podcast, Dr. help them become aware that here are screening tools you can fill out or quizzes that you can take and share with the teacher, share with your child, share with your other child's parent or, important adult in their life, so that when you come to the pediatrician, you are come armed with, here's what here's the data we have so far. Here's what the school is saying. Here's what we're experiencing, to make the most out of your time.
Absolutely.
With your pediatric
I want to talk
clinician.
about anxiety in the parents. You talked before about things being genetic. And so we're not going to blame or shame parents, but we need to talk about this.
Yeah, so anxiety definitely runs in families. So it's, genetically transmitted from parent to child in a lot of cases. And then also, I think as parents, we model a little bit of anxiety, whether we realize it or not. And like, for example, if there's something, what is it? We have a lot of, basically, as a parent, we can be a really positive role model and we can help buffer stress for our children. And so for example, like if I live in Florida and we get a lot of hurricanes. So let's say a major hurricane is coming, and if my response to it is, oh my gosh, hurricanes are so scary, we've got to run to Publix and get a bunch of water, we've got to do this, and it's panicked, and how is this all going to work? What I'm communicating to my kids is, this is scary, mom is scared, then I'm going to feel scared because, I don't know anything about it, but it seems like it's awful. Whereas on the other hand, if I can model like a sense of security and acknowledging that it's frightening, but that we've got it and that we'll be able to do okay as a family, then that communicates like a sense of calm to the children. And so I use the example of a hurricane to just say that, in addition to maybe sharing our genes with our children, we're also demonstrating and modeling to them how to manage stress and what to do in case of situations, of stressful situations, for the better or for the worse. And so for those of us who are still struggling with a lot of anxiety, maybe what we don't realize is that that there's a way that we're almost like transmitting that to our children. And so I bring this up again, not to blame or shame. This is just a part of who we are. It's, if you happen to have a lot of anxiety on your family tree like I do, that is just the case. And so doing what you can to try to manage and find a great toolbox for your own anxiety is not only going to help you, but it's going to set a positive example for the kids and
I love that. And I want
help
to add to
reduce their
that
anxiety.
because think about the way the parent is thinking. Not only do I have an anxiety disorder, we're talking about the parent who has an actual anxiety disorder that they're struggling with, but I also have to constantly co-regulate. They're talking so much about co-regulating, and you'll have to be calm for your child, but I'm not calm, I'm failing, and then you feel bad about yourself. No, it's the other way around. Think about a parent who I just said has ADHD, and they understand how to pick it up in their child and how they need to get help for their child. If you can address, first you have to know you have anxiety, then you have to address it. You're addressing your anxiety is modeling it for your children, not you're being perfect. There is no perfect parent. We have to get rid of that. So I really want to say that loud and clear. And I keep talking about this in my podcast over and over. And in fact, I interviewed someone who goes by the post-traumatic parent to talk about when you've had a traumatic childhood and how can you parent. It's all the same basic idea. By on your own addressing your issues, you will be modeling to your child. You don't have to be perfect. You don't have to always be regulated, but you do need to work on it. So some parents may need to access their own mental health for their own issues. But I also want to talk about how we become anxious from our children's anxiety. And that's not the same thing, right? I'm pushing here.
Oh boy, yes. So the bidirectional
Yes.
nature of anxiety between parents and kids. Yeah, of course, I'm a child and adolescent psychiatrist. I take care of kids with various mental health problems and have the privilege of getting to work with families who are navigating a lot of these struggles. And in that role, and then also in a role as a parent myself, what I know is as a parent, your child is the most important thing in the world. And so when your child is suffering, is struggling, that is incredibly stressful as a parent, especially if you're not sure what's going on. And it's incredibly anxiety triggering because you keep thinking, what is the worst case scenario? Did I do this? How is my child going to get better? How is this affecting their life? Is this going to negatively things now and for the future? And it's incredibly
Yeah, it really is. And I heard something
So,
just this
yeah.
past week that I really love. I think it's a reframing. Someone said, it's good news that you might be playing a role in your child's anxiety. Instead of saying, oh, it's not about your fault, but there's something that you're doing that could be making it worse, because guess what you can do? You can stop doing that. You can make it better. And that's something that you have more control over than your child's internalized anxiety, right?
Right. And then I would also add, like, I like the idea of positively reframing. I think I'll work with a lot of families where and I frequently tell families when I'm diagnosing a child with anxiety or evaluating a child for anxiety is I'll let them know, hey, this runs in families just like your eye color or your hair color. So, do you or does the other parent of the child have anxiety, or do you suspect? And usually one of the parents is like, I think it's me. It's definitely me. And so what I like to say is, this is actually a really positive thing because it gives you an appreciation, empathy for what your child might be going through. And as a psychiatrist, a very hard thing in practice is when you have a child who's struggling and the parents don't understand it. And this happens often in anxiety. Maybe not with, at least with one parent, well, they'll say, like, why can't she just shake out of it? I don't understand why she gets so stressed out before she has to speak in front of people. Or, why is she still so worried, or why is he still so worried about this? Come on, be tough, get over it. And those words are often spoken by an
I
adult
don't
who
get
has
it.
not struggled with an anxiety disorder and can be, yeah, and it can be very hurtful to a child. And so, on the contrary, having a parent who's like, I get this, I understand why you feel this way. In fact, I have felt very similarly.
Right, but
Here's
there's
what we're
also the
going to
flip
do.
side of the parent who understands it all too well, and their child's pain is greater than their pain, and they can't tolerate the child's pain, and therefore they're not helping the child move forward, right? Because I want you to talk just a minute about the cycle of avoidance and anxiety and how a parent could play into that or not.
Ugh. Like you say, avoidance, and I have this like negative visceral reaction because this cycle of avoidance is something we see so common in families of from very well-intentioned. Let me give an example. So first of all, let me define it. So avoidance is this idea of usually occurs when your child is very stressed out about something. Let's say I'm in Florida again, so I'm going to give you a lot of water-based analogies. In addition to the hurricane, we have a lot of end of school field trips to places that involve water. So let's say these kids are going to swim with the manatees, for example. And one of the kids is very scared about getting in the water, which is a very common phobia. And not because they don't know how to swim or not because of any particularly health condition or anything that we would expect would cause that. And so what's going to happen is the child is going to say, I don't want to get in the water. That's really scary. And the parent is going to see how upset this child gets, like how physically activated. Oh, I'm headache. I'm getting a tummy ache. I'm afraid that this is going to happen and I'm going to embarrass myself. And the parent wants, when you see a child in distress, all you want is to stop that. You want to fix it. You want to make it go away. And so what parents accidentally do is help their child avoid stress instead of overcome it. And so as a parent, it's really easy to be like, oh, baby, you don't have to get in the water. That I don't want you to feel that way because you want to take it away from them. But what we don't realize is that we're inadvertently making the anxiety and distress worse. You are robbing kids of the opportunity to be able to practice their coping skills, to master overcoming particularly stressful situations by allowing them to avoid them. And inadvertently, what we're communicating is like, yes, you're right. This situation is too much for you to handle. And so you should just not do it. And that's the opposite of empowering. It's disempowering.
Just that, but not just
So,
that. I'm sorry, but not just that.
yeah,
But
I would
what
say
avoidance does is right at that moment, the child feels better and the parent feels better. But what happens in the long run? Every time you don't face your fear, it grows. You're not even maintaining, you're exacerbating the problem.
Yeah.
Right. And this is not to blame. And then the question is, what is a parent to do who typically has their own anxiety and is anxious from their kids' anxiety? And you can send them to all the therapists in the world, but it's your interaction at the moment that's going to make the difference. How do we help those parents help their kids?
Yeah. And I think letting parents know about avoidance and just talking about it is really the first step because, again, it's one of these very frustrating, counterintuitive things about parenting where parents, we are well-meaning. We are really trying to help. We're trying to do the right thing and we're trying to help our children. And so it seems in the moment that this is the right thing. And, just letting families know about the unintended consequences of those choices and how and then empowering them with strategies to help their child through it instead of just saying, nope, rip off the Band-Aid, you've got to do it. This is where the role of therapy comes in and working with the parent and the child up with what is a plan? What are, when we get to the field trip and I'm near the water, what are things that I can do to help regulate, help calm myself down? Or what are things that we between now and the field trip to help me kind of desensitize or become more comfortable in water or address whatever the situations are leading up to that. And then the parent can become the coach saying, okay, here are the things we worked about in therapy. Here's what we're going to do to help you overcome this. And
But you also need the just right
very
challenge. I'm thinking
brave.
that there may be a child that says, I cannot go on that trip. I can't do it. And that is not necessarily avoidance,
Yeah.
but don't do nothing. Right? We're talking about the kind of exposure and prevention therapy for a
Right.
phobia. It means you gradually work your way up the ladder of how scary things rather than stay in the bottom of that ladder. So I think that's really important. And I want to mention space.
Right.
It was created by Dr. Ellie Leibowitz, who was, I believe, a psychologist. And I think it's called Supportive Parenting for Anxiety in Childhood something. I got 4 of the 5 letters, I think. And I'm going to link to that, I believe, in the show notes. I'm going to link in the show notes to SPACE, because this is a very specific way of working with parents. Because I believe that when children have anxiety, it's best to work with the parents as well. Some don't, but a lot of parents are like, okay, my kid's going to therapy for their anxiety, and then there's nothing given to the parents, and yet they're with the kid the rest of the 23 hours of the day or whatever, or 7 days a week, except for that 1 hour a week, right? So SPACE is very specifically to work with the parents to work with their kids. So I don't know how accessible it is, but it's a really good model. I think there are therapists who are trained in it, like potentially everywhere. I don't know if you can look up on a website or something. So in terms of the kind of therapy, you're a psychiatrist, you don't do therapy, you really do more medication, correct?
It varies. I would say as psychiatrists, we're medically trained, so we're typically MDs, and our job is evaluating a kid holistically, trying to figure out what is, making a diagnosis and trying to figure out what is going on and developing a treatment plan that can include therapy, can include medication. I think given the national shortage of child psychiatrists, in an effort to have more time to be able to see as many patients as we possibly can, a lot of us have focused more on the medication management side of treatment as opposed to med management plus therapy. But it depends where you practice. A lot of psychiatrists are also doing a lot of therapy.
I'm hoping to interview someone who's trained in SPACE, because I think it's a really important approach I want people to be more aware of. Let's talk a little bit more about medication, right? Say we've made the decision to do it.
Yeah.
What would that look like?
So first, what I would say is that the gold standard for medication treatment for anxiety is to use what we call SSRIs, or they're sometimes called antidepressants, but we're not using them for depression. In this case, we're using for anxiety. And so these are medications that can take really up to 4 to 6 weeks you take them on a daily basis. And what we believe is happening is that it's basically helping our brains adjust to our anxiety. And medication can be incredibly effective. It's very well tolerated. These medications have been studied for decades and decades in children and adolescents. Then I want to be careful of the exact things that I'm saying. So these would be medications like fluoxetine or Prozac, sertraline, which is Zoloft, citalopram, which is Celexa, or escitalopram, which is Lexapro. And sometimes what happens is a lot of the parents are on medication themselves for anxiety, or one of these SSRI type medications for anxiety. And what I would say is one of the first questions I ask families when we're talking about medication is, so one of the parents likely has anxiety. Have you tried medications? And if so, which ones worked well for you and which ones didn't work? Because that can help direct us to know more quickly what would work. What about
the genetic testing? I'm hearing more and more people are using the genetic testing. What are your thoughts on that?
So you're talking about the pharmacogenetic or pharmacogenomic testing, which is being marketed to families as this idea of give us a little saliva sample and we'll be able to tell which medicine is going to work for you for anxiety or depression. And we've done some really excellent studies in the field on this. And essentially what we've found is, unfortunately, the technology is not quite there. And the bottom line is it's very rarely going to be able to tell you which medication will work in your brain. It can give you information about how quickly or how slowly your body metabolizes certain medications, which can guide dosing adjustment, can help you know if you're going to need a really low dose, or if you're a rapid metabolizer and your body eats up meds really quickly, maybe you're going to need to push to a higher dose. So it provides information to that end, but I would say it's certainly not a necessary first step in considering medication treatment. And unfortunately, currently, it's not lived up to the hype of being able to find the right medicine for you. Just like scientists and clinicians treating any other illness or disorder, we rely on the evidence. And so we have a lot of evidence to suggest that these SSRIs are very effective in children and teens with anxiety, and can be well tolerated side effects.
In terms of what to expect when your child is first started. And what I'm thinking about is it should be started at a low dose, meaning that's not going to be the correct dose. And how long would it take to take effect?
Yeah, so we typically, start with a very low dose to make sure that to help the child adjust to the medication. And sometimes in the first couple of days, as your body's adjusting the medication, what I'll tell families is like, you may feel a tiny little bit of stomach upset, or you may feel like you have extra energy or be a little tired. But typically, your body will adjust over a couple days and that should go away. You should really have very minimal, if any, side effects. But it's almost like a vitamin in the sense that it takes time to build up into your system. It can take 4 to 6 weeks to see a maximum effect on the first dose. And for some kids, the starting low dose is actually going to be where we end up. But for a lot of kids, we're going to end up escalating after 4 to 6 weeks and to try to get to a target dose that's for
That's
their
a really
body
good
and brain.
explanation. So, what would you say about knowing when a medication is not working? How long would that take to even know?
It depends. Sometimes in the first couple
I see.
days, you will not be able to tolerate the medicine, or there will be some side effect and you'll think, oh my gosh, I hate this. Or oftentimes if we start on too high of a dose for a child, then they'll feel they can develop what's called activation. So they can feel like way too much energy and feel extra antsy and irritable. And it's usually very obvious, and you stop the medicine and that was not a good one for you. And then you can try another one, typically starting at a low dose like we recommend, to try to avoid that type of side effect. But we have dosing guides and dosing ranges that help us understand like what are typically effective doses for these meds for children and adolescents, so that when you get to that dose, you can evaluate, are we there? Are we feeling better? Has there been a trend towards, as we've gone up from one dose to the next, we tend to start feeling much better, but we're not quite there. So you need to increase it further. Those are all signs that this is potentially a helpful medication. If you get to a target dose and you have not seen really anything, at that point, I think it's time to consider switching alternate medication if you haven't had any signs that it's helpful or effective.
Could there be any other reason for the medication is not working? Say you've tried several.
Anytime there's a medication where you're seeing this medication is not working for me, it's always a kind of a gut check, and you want to step back and say, okay, am I treating the right thing? Is there something that we're missing? Since we're talking about anxiety here, we've thought that this is anxiety, but have I really checked all of the bases, or checked all the boxes rather? I'm mixing my metaphors. Is there something else that could be going on that I'm not sure of? And oftentimes I would say, we have a whole approach that we like to use clinically and that we teach our pediatric clinicians about approaching anxiety. And one of the to rule out is trauma, any sort of major traumatic event that could be resulting in a post-traumatic stress symptom, which is not going to respond really easily to SSRI medication and needs a different type of therapy and a different level of treatment. So I would say you go back to the drawing board a little bit, and when things aren't working, and you make sure that you've looked at and considered other diagnostic possibilities.
Really
that you're not
important to know. And I think that also underscores the importance of having counseling at the same time. I do believe that almost across the board, anybody who's on medication should also be in counseling. What do you think about that?
Oh my gosh, I wish that every single person who was seeing their pediatrician about mental health problems, and even those who are not able to access anyone about mental health problems, could still have access to therapy. I think the reality is that it is complicated. Therapy is not a one and done type thing. It requires an investment. It requires a lot of time and sometimes expense because of issues with lack of health parity from insurance. It's not, you're not paying a very minimal copay to see a therapist if they're taking your insurance at all. It can be expensive, and it requires the involvement of the parent and the child in, let's say, 6 to 8 1-hour visits over the course of however many months at least. And so all of that is time away from work, time away from other children. And so again, as a parent, I recognize the real cost of all of this, that it is very hard to invest in therapy. And we're as simple and as like, you just hop
I do
Zoom
want to say a
call with
couple
your
things. I have several
therapist.
things. Number
And
one is that sometimes it's nice to start counseling first for especially the milder cases and see if that's enough, and only then start the medication if it's not enough. But for some kids, their anxiety is so strong they can't engage in any therapy, and you need to do the medication first. I do have a subset of kids, those who have more of a social anxiety, who absolutely do not want therapy. And they sometimes do very well in medication alone. And then the third thing I want to say is not all therapists and therapy is created equally. It may not be a good match, the specific therapist or the subtype of therapy, especially when it comes to trauma. Okay? Because sometimes they're doing CBT and it's not even, maybe it's trauma informed or maybe it's not, but it's not trauma focused and it's not the same thing. And they're getting worse or not getting better, and you're upping the medication because you're not appropriately addressing. They're in therapy, but they're not in the right therapy or with the right therapist or both.
I think that's sometimes hard. It's hard for clinicians even to figure out if we've referred somebody to therapy, how is it going? And even harder for parents to try to understand what's going on, because especially if the parents don't have as much of a role in the therapy. I'm with you, Dr. Minkin. I want the parents to be involved in therapy more than beyond just a quick check, like 2 thumbs up, school was great. The parents need to be given support and strategies for how they can be the child's coach at home and how they can be supporting them throughout the week to implement these strategies. And even if you've got a very savvy, let's say 17-year-old teen, that teen still is living in the same house as the parent. And so it can only help the teen to have parents and family members on board to know how they can continue to support the teen to be able to run these strategies when you're in the heat of a moment of an
Absolutely. And I
anxiety
always say
episode.
you are entitled to see progress in your therapy. It may not be overnight, but if your child's been in therapy for months and you're not seeing them get better or you're seeing them get worse, that's a big red flag. Advocate for better. Better.
Yeah. And I absolutely. And I also want to underline another great thing that you had said in this conversation about therapy, where you're saying, you made this excellent point about sometimes kids with moderate or high severity anxiety cannot engage in therapy, and that they really require medication to be able to kind of bring down their overall level of anxiety so that they can sit in a room and talk about this thing that they're scared of. Like if it is so overwhelmingly frightening, you are not helping the child by exposing them to a tsunami wave of stress and anxiety when they don't have the ability to even be present in the room to figure out how they're going to cope with that. And so, again, that's part of a little bit of a trial and error between the therapist and the parents to figure out, do we need something else to help this child be successful and get the
Absolutely.
most out of therapy?
So one more thing, and then I know you have to get back to your busy schedule. One more topic I want to bring up, which is that when we talk about missing a diagnosis, we mentioned before that anxiety can also be associated with ADHD. It can also be associated with autism. We didn't mention autism at all, and I want to bring up autism and bring back ADHD and autism together, which is now being called ADHD, at least on social media. It's not a DSM diagnosis, but they commonly co-occur, both autism and ADHD. And those diagnoses, if they have not been made, should especially be considered if the child is not improving.
Absolutely. Yes. Thank you for bringing that up. Again, we focused on the comorbidity or how ADHD and anxiety commonly co-occur. And you bring up another good point of autism and anxiety commonly co-occur. And I think right now I love that there's increased public awareness of autism spectrum disorders and neurodiversity. And I love the new branding of neurodiversity, and wish that we had talked about that years ago when I was in training. Yeah. But children and teens and people with autism very commonly have specific anxiety or have high levels of anxiety. And they may, depending upon how high functioning they are, they may be presenting to their pediatrician mainly with anxiety without anyone knowing that there's underlying autism spectrum. And so that's an act to make sure that you've considered
with a good therapist. I had a
neurodiversity.
therapist who I contacted, and again, it's extra for a pediatrician to be reaching out to therapists, although I wish that we got paid for doing this. I did that, and the therapist said to me, hey, have you thought this kid might be on the spectrum? And it did not occur to me in my short visit, and that was a really helpful tip. And so that working together, should you be able to do that, or even as the parent, you working with the therapist and bringing it back to your pediatrician for a referral would be an avenue for picking up that missed neurodivergent diagnosis. So thank you so much for doing this with me. I know you got to get back to seeing your patients, but I really appreciate it. Thank you so much for doing this with me.
This was my pleasure. I'm so excited to get a chance to be on your podcast. It is an excellent resource for parents and for families. And I know you have such a passion for helping kids and families with behavioral problems or behavioral health problems. And so I'm so glad that you've taken that.
I want you to know that just while I was waiting for you to
anxiety.
enter the room for this talk, I already shared your podcast with 2 other pediatricians, and I'm going to continue to share it because it is so helpful to have some support out there for the very hard work that we're doing in the trenches as pediatric clinicians. Give you guys a hug again. All right.
Absolutely.
Thank you so much.
Oh. Thank you for having me. What a great fun conversation.
Thank you for listening to Kids Matter. Raising healthy, happy children takes a village, and I'm grateful you're part of ours. If today's conversation resonated with you, please share this episode with another parent, grandparent, teacher, or anyone who cares about kids. Together, we can build the supportive community our children deserve. I'd love to hear from you. Share your thoughts, questions, or suggestions for future topics at kidsmatterpodcast@gmail.com with no exclamation point. Your voice truly matters. Until next time, keep advocating for the children in your life because kids really do matter. They are our future. I'm Dr. Elise M, and this has been Kids Matter. Please note that while I am a pediatrician, I am not your child's pediatrician. This podcast is for informational purposes only and does not constitute medical advice. For any medical concerns or decisions, please reach out to your child's healthcare professional.